When the only constant in life is change, you need to be ready. This is the Man-Made Survival Show.
Hello everybody, my name is Jose Pro, Man-Made Survival. Thank you so much for coming back to the channel and watching this video. Thank you for sharing it. Please continue to do so because this information is getting out and I'm getting positive feedback, and it's all thanks to you. I greatly appreciate it. Now, I'm going to give you the numbers of infected people and everybody else that has been affected by this, and I know it's going to just blow your mind when you hear everything I got to show you today. Official brick coronavirus count is 81,269 infected with 2,772 dead. The realistic estimate is over 300,000 infected with over 30,000 dead. The number of infections outside of China, which is 3,120, breaks down like this. South Korea, 1,261, Italy, 374, Japan, 178, and Iran, 139. The countries that are not affected by coronavirus is Germany, Switzerland, Croatia, Iraq, Spain, Algeria, Austria, Brazil, Italy, Australia, Malaysia, France, Vietnam, Canada, Kuwait, Macau, Taiwan, Thailand, Hong Kong, Singapore, South Korea, USA, Egypt, Finland, Belgium, Lebanon, Sri Lanka, Israel, Cambodia, Nepal, Oman, Afghanistan, Philippines, and of course China. And once you hear all the countries that are affected, then you wonder and say, why in the world are these people not calling it a pandemic yet? And there's several reasons for that, you know. One of them, of course, is the stock market. If they call a world pandemic, things are gonna crash even worse than they have crashed in the past few days. All right, just because the CDC had updated the number of cases in the U.S. and how many people had erupted out of Italy, the stock market crashed over 25% and over 1,000 points. So that's one of the main reasons why they're not wanting to let people know, or not let people know, but the reason why they're not calling it a pandemic yet. And that takes me to this headline: CDC outlined pandemic planning as fears send stock plunging for second day. This is from CNBC, and you're going to hear the video of their explaining it and how they're trying to make people not freak out so much.
Robert Kadlik, HHS's Assistant Secretary for Preparedness and Response, and Dr. Stephen Hahn, the Commissioner of Food and Drugs. As of this morning, we still have only 14 cases of the China coronavirus detected here in the United States, involving travel to China or close contacts with those travelers. We have 3 cases among Americans repatriated from Wuhan, and we have 40 cases among American passengers repatriated from the Diamond Princess in Japan. I want to thank the responders and communities that have worked with HHS and the administration to provide these Americans with the treatment they need. I'm also grateful to the governors and other state and local leaders who have worked with us in close partnership so far. The immediate risk to the general American public remains low. But as we have warned, that has the potential to change quickly. There is now community transmission in a number of countries, including outside of Asia. That's deeply concerning, and community spread in other countries will make successful containment at our borders harder and harder. That's why we've already been working closely with state, local, and private sector partners to prepare for mitigating the virus's potential spread in the United States, because we will likely see more cases here, as we have said throughout this episode. Dr. Schuchat will provide some more details on what that will look like, including how we would treat potential cases that arise from community transmission here in the United States. This preparation has been possible in part because of how aggressively President Trump has responded to this outbreak. As soon as we knew of the threat presented by this novel virus, public health leaders were monitoring it and beginning to prepare. The travel restrictions that the President put in place at the beginning of this month have given our country valuable time to continue to prepare, and that is precisely what those measures were designed to do. That includes working with Congress. Yesterday, the White House sent a request to Congress to make at least $2.5 billion in funding available for preparedness and response. There are 5 major priorities within the supplemental request, which I underscored this morning before the Senate Appropriations Committee. First, we need to expand our surveillance work, building on an existing system we have within CDC's influenza surveillance network. Second, we will need funds to support public health preparedness and response for state and local governments for what could be a very large-scale response. We don't know, but we must prepare for that just in case. This support complements the significant funds that these partners have received from CDC for preparedness, about 2/3 of $1 billion a year in recent years. Third and fourth, we need to support the development of therapeutics and the development of vaccines. Given the scale of this outbreak, the private sector sees a real market for both kinds of countermeasures, as well as for diagnostics, but federal funding and guidance can accelerate this work. Dr. Fauci will address the current status of that work in more depth. Fifth and finally, we need funds for the purchase of personal protective equipment for the Strategic National Stockpile, a topic that Dr. Cadlick can address. I'll conclude by noting that though scheduling conflicts prevented this briefing from including other members of the President's coronavirus task force, we'll be providing a new update from interagency leaders soon, and we expect to continue doing so regularly. Earlier this afternoon on CNBC, the National Economic Council Director Larry Kudlow offered an update on how we see this outbreak affecting the economy. This morning, Dr. Messonnier from CDC provided the usual telebriefing. As Dr. Schuchat will emphasize in just a moment, the Trump administration will continue to be aggressively transparent as the outbreak and our response evolve. We'll continue keeping the American people and the media apprised of the situation, as well as what everyone can do to prepare. In the meantime, I'll continue to work closely with President Trump and the President's task force on our preparations to keep Americans safe.
All right, so you heard them. All right, they keep saying that the risk is still low, but it can change. Now, there's a potential of things getting pretty bad. They are setting aside $2.5 billion for preparedness. The Trump administration is going to be as transparent as possible to let the American people know. And they're going to let you know what you can do to prepare. They're going to try to tell the American people what to do to prepare. But here's the thing about those statements that this guy just made. One of them is that the risk is still low, but it can change. Of course it can. And of course, I don't say that the risk is low because we have all these cases, or not cases, we have all these people who are self-quarantined, but they're not under any kind of supervision. And if they are let loose and out and about without being tested, quarantined, or anything like that, the risk is very high because you don't know who is infected. And those people have recently come back from China. These people call and say, hey, I just came back, just letting you know. And they were like, just stay home, self-quarantine. And if you get sick, don't go to the doctor. You got to call us first. So that's not very comforting. They have set aside $2.5 billion for preparedness. All right, that's a lot of money, but I'm telling you, they're not getting prepared for us. They're getting prepared for themselves. The Trump administration is going to be transparent. And I kind of call BS on that one because we know that Trump has come out and tried to play things down, try to say, everything is good, that he's actually mad that people are trying to use this as a panic because the stock market has gone down. It's election year, so he doesn't want to go into the election, with the economy being in the tank because of this. So, of course, he's going to be worried about it, and he has, skin in the game. I'm not saying that Trump has done anything wrong. I'm just saying that he has he has a reason to be worried about it because this year is election year. If this would have happened a year ago, 2 years ago, he'd probably be singing a different tune. Now, they want to tell people what to do to prepare. All they have told people is that they need to wash their hands, cough in their sleeve, and stay away from people. But give me a break, all right? That's not how you prepare. How you prepare is that you got to have a quarantine room. You have to have the supplies for the quarantine in your house. You have to have the food, the water, and things. So if you have to stay at home with the virus because all the hospitals are already full and you have to stay home, then you're going to need the medicines for that as well. So just telling people to wash their hands, cough in their sleeve, and stay away from people is not going to cut it. So thank God that there's channels like mine, Man Survival, that tells you how to prepare. And now that's out there. I'm not saying I'm the only one. There's other people doing a great job. And thank you everybody in the comment section who has left me tips on listening to other people that also talk about this. But anyways, we're going to move on to the next one. All right. And you're going to hear that even though the first guy in the video said he was trying to be more optimistic and say, it's all right. Another guy said that this is airtight and it's contained. We're calling it BS. And the CDC has come out contradicting itself, saying this. Here's that soundbite.
The fact that this virus has caused illness, including illness resulting in death, and sustained person-to-person spread is concerning. These factors meet two of the criteria of a pandemic. As community spread is detected in more and more countries, the world moves closer towards meeting the third criteria, worldwide spread of the new virus. The U.S. has been implementing an aggressive containment strategy that requires detecting, tracking, and isolating all cases as much as possible and preventing more introduction of disease, notably at points of entry. We've restricted travel into the United States while also issuing extensive travel advisories for countries currently experiencing community spread. Our travel notices are changing almost daily. We've also enacted the first quarantine of this scale in the U.S. and are supporting the State Department and HHS in repatriating citizens from high-risk areas. We are doing this with the goal of slowing the introduction of this new virus into the U.S. and buying us more time to prepare. To date, our containment strategies have been largely successful. As a result, we have very few cases in the United States and no spread in the community. But as more and more countries experience community spread, successful containment at our borders becomes harder and harder. Ultimately, we expect we will see community spread in this country. It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness. There are three categories of NPIs. Personal NPIs, which include personal protective measures you can take every day and personal protective measures reserved for pandemics. Community NPIs, which include social distancing measures designed to keep people who are sick away from others, and school closures and dismissals. And environmental NPIs, which include surface cleaning measures. NPIs routinely recommended for prevention of respiratory virus transmission, such as seasonal influenza, include everyday personal protective measures. These are preventive actions we recommend all the time for influenza season. Stay home if you're sick, cover your cough, wash your hands. These NPIs are recommended during a pandemic, regardless of the severity level of the respiratory illness. Personal protective measures reserved for pandemics include voluntary home quarantine of household members who have been exposed to someone they live with who is sick. Now I'd like to talk through some examples of what community NPIs look like. These are practical measures that can help limit exposure by reducing face-to-face contact in community settings. For schools, options include dividing students into smaller groups, or in a severe pandemic, closing schools and using internet-based teleschooling to continue education. For adults, businesses can replace in-person meetings with video or telephone conferences and increase teleworking options. On a larger scale, communities and cities may need to modify, postpone, or cancel mass gatherings. For healthcare settings, this might include triaging patients differently, looking at how to increase telehealth services, and delaying elective surgery. The implementation of environmental NPIs will require everyone to consistently clean frequently touched surfaces and objects at home, at school, at work, and at large gatherings. Local communities will need to make decisions about what NPIs to implement and when, based on how severe transmission and disease is and what can be done locally. This will require flexibility and adaptations as disease progresses and new information becomes available. Some of these measures are better than none, but the maximum benefit occurs when the elements are layered upon each other. Some community-level interventions that may be most effective in reducing the spread of a new virus, like school closures, are also the most likely to be associated with unwanted consequences and further disruptions. Secondary consequences of some of these measures might include missed work and loss of income. I understand this whole situation may seem overwhelming and that disruption to everyday life may be severe, but these are things that people need to start thinking about now. I had a conversation with my family over breakfast this morning, and I told my children that while I didn't think that they were at risk right now, we as a family need to be preparing for significant disruption of our lives. You should ask your children's school about their plans for school dismissals or school closures. Ask if there are plans for teleschool. I contacted my local school superintendent this morning with exactly those questions. You should think about what you would do for childcare if schools or daycares close. Is teleworking an option for you? Does your healthcare provider offer a telemedicine option? All of these questions can help you be better prepared for what might happen. CDC and other federal agencies have been practicing for this since the 2019 influenza pandemic. In the last 2 years, CDC has engaged in 2 pandemic influenza exercises that have required us to prepare for a severe pandemic. And just this past year, we had a whole-of-government exercise practicing similarly around the pandemic of influenza. Right now, CDC is operationalizing all of its pandemic preparedness and response plans, working on multiple fronts, including specific measures to prepare communities to respond to local transmission of the virus that causes COVID-19. I want to recognize that people are concerned about the situation. I would say rightfully so. I'm concerned about the situation. CDC is concerned about the situation. But we are putting our concerns to work preparing, and now is the time for businesses, hospitals, communities, schools, and everyday people to begin preparing as well.
So you heard what she said, right? Now she's saying it's not a question of if, but when it happens. And I'm going to tell you, I know when it's going to happen. I know when they're going to say that the cases in the United States are increasing. You want to know when? I have the exact time when they actually start testing people. We know right now they're not testing anyone. So, and they have come out and said in the guidelines, it says that certain people are not going to get tested. There were people who were quarantined in the military facility, and they were asking, why are we not being tested? Even though that they have eaten in the same room with the people that they potentially are sick to. They were eating in the same room. They were digging through the same basket of food, trying to get snacks or whatever. So we know that they're not testing people. And we know for a fact that the CDC has only tested less than 500 people. Excuse me. They have tested less than 500 people. So come on. And she has said, her tune changed. She said, this is going to be a potential drastic change in our lives or something like that. The point is that now they're not playing with it. They're not saying, well, you know, we're optimistic, things are going to get better. No. She was talking about closing schools, businesses, and large gatherings, with mainly that would mean church, right? Church services throughout the country. And she was saying that maybe do some kind of internet work from home or school from home. But come on, I mean, if there's people that are going to do that, I really doubt that they even log in and try to do any kind of work. And there's people that they do hands-on work. You know, if you work at a warehouse, you cannot do your work from the warehouse, you know, through the internet. So a lot of things are going to change. They're going to change hard. So you got to be ready financially too, to be able to pay some bills. All right, because more than likely you will not be able to go to work when it actually hits the fan here in the United States. And we're probably a week or two away from that. Now, here's the interesting thing about what she said about gatherings is about church, but also let's remember this is election year. There's a lot of rallies out there, and Trump is going around the country. And let's just give a scenario. Let's say somebody from whoever, whether it's a terrorist attack or if it's somebody from the other side who really hates Trump supporters, they know they're sick and they just go out there and start coughing everywhere. We know that Trump can gather up to 10,000 people and even more in a stadium. So if somebody who's sick, or more than one person, if a group of people do that, they just go over there and try to get other people sick, it's going to explode like that in the United States. There's going to be cases at the wazoo, so much more than they will be able to handle. This is why you got to be ready. You got to pay attention. You got to be smart. I know Trump is very popular right now. He has done a great job with the economy and everything else. But you have to be wise and you have to be careful going out, especially if he visits a state where we know that there's cases or there's people that are self-quarantined. All right? So keep that in mind. Now, other stuff that she said also goes along with this, with the next headline. Because she was talking about that the closing, trying to close the border and all that is going to make things worse. Or, it's hard to do it, hard to keep the stuff from coming in because of the border. But here's the headline. Coronavirus screening missing more than half of cases, a study says. This from yahoo.com. Paris. Global screening efforts to prevent the rapid spread of coronavirus are likely to fail, according to new research warning that even best case screening of air travelers will miss more than half of infected people. Researchers in the United States and Britain, in a study published in the journal eLife, used computer models to predict the impact of screening based on the latest data of how the coronavirus behaves and how long it takes for patients to show symptoms. And here's a quote. If someone doesn't realize that they have been exposed and doesn't yet show symptoms, they are fundamentally undetectable. Kaylin Gostick, a postdoctoral scholar at the University of Chicago and lead author, told AFP, "We estimate that on average, screening will miss 2/3 of infected travelers." There you go. Just enough. That's enough. We know that there's flights still coming in from everywhere. I don't know. They have canceled the ones from China. And before they even went to quarantine, 5 million people left. They left to other countries. They quickly closed the border to South Korea. I don't know if we did, but I know other countries around they did. The same thing with Italy and Japan. But we don't know how many people are still coming in from those places to the United States. And, in Canada, there's people in Canada who have been infected. And those people that are exposed, we don't know if they've been to the United States, after getting infected and before they even know it. And let me point out one thing about Italy, is that how suddenly everything blew up. That means that people more than likely were infected with it 2 weeks ago. At least 2 weeks ago, 14 days ago, or from Saturday. And now these people are starting to get sick and they have to go to the hospital. They're getting tested and they get tested positive. So whatever, all those people that are in self-quarantine, it hasn't been 2 weeks yet, at least not for most of them, and they haven't shown any symptoms. And we know for a fact that there's some cases that go over 27 days, or that people are spreading it without knowing they're sick. And when they go to the hospital, they find out they're super spreaders. They don't have the symptoms or anything, but they're sick with it, and they're able to infect other people. And they have also come out and said, which is a very important development, is that even though they have not cure you, you have come out of the woods with the coronavirus and they send you home, that doesn't mean that you're still not contagious. And if you catch it again for a second time after being infected once, you can die of a sudden massive heart attack because of the medicine and the virus itself. Now, with this last video I'm going to show you, this is going to give you this should send shivers down your spine. And this should be a call to get you prepared. Because they have told us that it's bad without telling us it's bad. Like outright saying it's bad, They're dancing around the bush, or they're beating around the bush. But they're pretty much, if you read between the lines, they have told you that this is a lot worse than they're letting us know. Here's that video that I was talking about.
HHS on that.
Mr. Secretary,
My budget
you're supposed to keep us safe.
My budget supports the men and women
You're
of the
the
Department
Secretary
of
of Homeland Security.
Yes, sir.
And you can't tell me if we have enough respirators.
What I would tell you is that the budget, my budget, our operations are focused not only on the men and women of DHS, making sure they're protected to do their jobs, to screen individuals coming in. We're working with HHS,
You don't know.
CDC, and their
You don't know
budgets
the answer, do you?
to ensure that they have enough medical
Do
equipment.
we have enough face masks?
We, for the Department of Homeland Security, we do.
I'm not asking for the Department of Homeland Security.
Are you looking-
I'm asking for the American people.
For the entire American public?
Yes.
No, I would say probably not.
Okay. How short are we?
I don't have that number offhand, Senator. I will get that for you.
Okay. But I want to be sure I understand. Somebody
Yes, sir.
is doing modeling
Yes, sir.
on how many cases we're anticipating. You're
Yes, sir.
just not aware of that.
You're asking me a number of medical questions that
I'm asking
CDC
you questions
and
because you're
HHS
Secretary of
are
the
focusing
Department
on.
of Homeland Security, and you're supposed to keep us safe.
Yes, sir.
And you need to know the answers to these questions.
And
How far away are we from getting a vaccine?
in several months.
Well, that's not what we just heard testimony about.
Okay.
Who's on first here?
HHS is
What's
the
on
lead
second?
federal agency for the coronavirus response. I would refer you to the CDC on
Mr.
specific
Secretary,
questions.
I'm going to hush here. You're supposed to keep us safe, and the American people
Senator-
deserve some straight answers on the coronavirus. And
Senator,
I'm not getting them from you.
I
That's
disagree.
all I have, Madam Chair.
So you heard the Secretary of the Homeland Security. He just got grilled by the Senator Kennedy, and you heard him say, "Are you guys prepared?" Yeah, they're prepared, but that doesn't mean they're prepared for you. Do we have enough respirators for the country? The guy's like, nope. I mean, you saw his face. Just see the body language. So even though they're here to protect us, and they do a great job, every day. There's a lot of things that they have prevented that they could have gone very bad. But the point is that when they get ready, the $2.5 billion that they set aside to prepare, it's not for us. It's for them. And of course, we need them to be protected, not because this could be the best time for any other country to just, do a chip shot and attack us, or the medical professionals, they're going to need the equipment so they can take care of people. So here, that's the thing. You must be ready for yourself and your family. There's some people in the comment section that have said that, they have gone out and bought food and they're getting ready. And that's great. And I have people here that have told me that they've called me up and say if I could go to their home and get their house ready, for anything that happens. So people are paying attention, and I greatly appreciate everybody that's listening to this and sharing it. But you need to, if you have not yet taken proactive measures to prepare your house, you need to do so soon before the panic hits in the United States. And they will keep us from going to work or, going to school and everything else. If you have college students that are away, out of state, you need to talk to them and tell them they need to get ready. They're more than likely to be quarantined in their dorms. So sit down with your family. I've said this from day one. Sit down with your family. Look at all the scenarios you need or that you potentially have. Like, for example, somebody in college far away, or if your work requires you to travel, and outside of the state or outside of your town or whatever, you must be ready for it. Especially keep an eye on places that are getting infected. That way you don't become infected and possibly come home and infect your family. All right. So again, my name is Jose Prado, Amendment Survival. Thank you so much, and always be ready.
The Man-Made Survival Show.